for joining us today and welcome you to our webinar, How to Get Senior Leadership Buy-in for Wellness. Before we get started, here are just a few tips to help you get the most out of today's webinar. The entire presentation is being recorded and will be available after the webinar at wellsteps.com on the free webinars page. You can also go there to download slides now or after the presentation. There are over 400 participants today, so all phones have been muted and you will not be allowed to speak, but you can participate at any time by typing in questions or comments. To do so, simply click on the question and answer link at the bottom of your webinar control panel. We will be monitoring this section during the webinar and will answer as many questions as possible. If we don't get to your questions, please feel free to email me at ryan@wellsteps.com and I will respond to those personally. Today's presentation will last approximately 50 minutes with a 10-minute question and answer period at the end, and maybe with another question and answer break before that. It is now my pleasure to introduce today's presenter, Dr. Troy Adams. After 13 years in academia, Dr. Adams is now the principal in the Lifestyle Research Group and the COO of WellSteps. He has provided consulting expertise to the corporate wellness community and to the private club industry for more than 20 years. He has presented and consulted all over the globe and published numerous scientific publications, and we are excited to have him here. By way of introducing today's topic, I just want to point out that after each of these webinars, we look over all of the comments that we receive from all of you, and one of the most commonly asked questions we get is how do I get my senior leader to buy into wellness? So due to that demand that we have for that question, we wanted to present today's topic, and we're excited to hear now from Dr. Adams.
Thank you very much, Ryan. We're delighted to have all of you with us today. We know that you've taken time out of your busy schedule, so you know what? Let's get right into it. I'd like to start by saying nothing exerts a greater influence on whether or not wellness happens at the workplace than the influence of leadership. We all know if leadership sees the value in helping employees be healthy, then poof, it's magic. Wellness just happens. If there is not leadership support, I know that some of you have felt that, then we all have work to do. So here are the objectives that we're going to go over today. First of all, we're going to talk about how leadership support is a secret formula, just with an example that I have. And we're going to talk about overcoming barriers. I'm really excited about that because we got some wonderful feedback from our LinkedIn group, Wellness is a Business Strategy, on barriers to wellness that they have heard from senior leaders. Then we're going to talk about the real business case for wellness. And then we're really excited to introduce a new tool, a free tool on our website called the Wellness Budget Calculator, to help you find the money for wellness that is right in front of you without doing anything differently. So let's start with a story. The secret formula. When you think of the secret formula, you may think of the most secret formula in the world, and it's for this product. I learned firsthand about this secret formula when I worked as an intern at Coca-Cola World Headquarters in Atlanta way back in 1987. Yeah, I know I'm dating myself a little bit, but you may recall that this was 2 years after the New Coke fiasco. Some of you may recall that, in which Coke released New Coke, and then in 77 days, less than 3 months, they replaced it again. So the atmosphere, the paranoia was pretty high at World Headquarters at Coca-Cola in 1987. There was a lot of interest in preserving and protecting that secret formula. So just with that context, it's important that you know that. One of the things I did as an intern was to conduct interviews. I asked them to help me get a randomly selected gender balanced sample of employees. I think we had 40 employees, and these were all different types of employees, all different parts of the company. What I was trying to do was learn more about perceived benefits and barriers related to engagement in the Coca-Cola wellness program, which, you know, back in the 80s was heavily fitness center based, but it was a pretty good wellness program. Well, as luck would have it, one of my interview participants worked on a secure floor in the product research with the secret formula. And surprisingly, he agreed to meet with me. But he didn't warn me over the phone that I would have to go through multiple layers of security. And I did not know then, but as I look back, I realized that I had an early view at what security would be like at airports. It was a little bit like that, all around the secret formula for this product. And so we sat down in a lab setting. It reminded me of my chemistry classes in college. And there was on the table in front of me one of the largest, hugest glass bottles of Coca-Cola I had ever seen in my life. It was massive. So before we got started with my questions, I just happened to reach out and touch the bottle. And I think he left it there on purpose because he said, don't, you just ruined an experiment. And I, of course, had a shocked look on my face. He started to laugh because he was joking, but he did tell me a little bit about the research they did in his lab, and it involved the secret formula. Of course, they don't really talk much more about the secret formula than that. I've long forgotten what I learned from that interview. I really have. I don't even remember what I learned from the article that I published based on those interviews, but I remember one thing about leadership support secret formula. What I remember from my experience at Coca-Cola was this. I learned how to answer this question. Why did Coke have a wellness program in the first place? And what I learned was that the CEO of Coca-Cola liked to golf. And he golfed very commonly with another CEO who happened to be the CEO of Tenneco in Houston. And Tenneco was one of the early pioneers in worksite wellness. They were the ones who employed the worksite wellness legend, Bill Bond. Many of you have heard of Bill. He's a member of the group Wellness is a Business Strategy, and just a really, really good person, and I consider a great friend. So the CEO for Tenneco, he liked to brag. And so in what we'll just call a case of wellness envy, the CEO for Coca-Cola got tired of listening to the CEO for Tenneco, and the next thing you know, poof, Coca-Cola had a wellness program with 5 full-time employees, just like that. So he didn't have to listen to the bragging anymore. Well, it doesn't really matter how the senior leader gets on board. In this case, it was wellness envy, but the senior leader got on board, problem solved. Leadership support creates instant traction for wellness. How do you get support when it's weak or when it's non-existent? Just want to give you a little perspective from the senior leader's point of view. These are all the employee-related costs. These are some of the employee-related costs. The CEO and particularly the CFO, we find these to be the most difficult group to work with, those CFOs. They know that a check is being written to pay all of these costs: salary, healthcare, short-term, long-term disability, workers' comp, and the list goes on. But look at how many of these are health-related. And so they're acutely aware. I promise you, senior leaders are acutely aware of what they're spending on the health of employees. We know, for example, that the examples that get tossed around a lot are Starbucks and General Motors spend more on employee healthcare than they do on coffee beans and steel, respectively. And I think that's true for many, many other businesses and many other industries. They know, leaders know how much they spend on healthcare, and so they're a little resistant to spend anymore. So if you had to guess, how would a leader answer this question? If you had to hire 100 workers by Friday, that's tomorrow, which would you choose? A, 100 healthy workers, or B, 100 unhealthy workers? You know, it's self-evident how they would answer that question. They all get it. In fact, Dee Eddington, in a recent LinkedIn discussion, said that in his long career, you know, he's in his early 70s, he had very, 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 very few senior leaders fail to understand the strategic value of employee healthy workers. He said, by and large, they understand the value. And I want to say that has been our experience at WellSteps also. But Dee also mentioned, and he used this interesting term, he said, there are blockers. And the blockers are most often the limiting factor in wellness uptake and implementation. And the blockers can be brokers, consultants, or even protective middle managers. So if you've worked in this business long enough, you've encountered blockers. We certainly have. Blockers often, they don't have the full vision, even though they might think they do. They also tend to be acutely focused on the bottom line because their job is at stake. And I don't mean to offend anybody. This is just true. We've worked and kind of characterized some of these nice folks. They're just trying to do their job. but the net effect is that they're blocking employees from improving their health. We've found basically that blockers have feelings about wellness that are something like this dad. Now you may recognize this comic strip. Hey, Jeremy, do I get any change back from the $20 I gave you last night? Oh yeah, about that. Spent this, lent that, blah, 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 blah. So I owe you. Yeah, give me another 20 and we'll call it even. They feel like we've got the hand in the wallet and it's never really going to stop. So that being said, one of the things I did to get ready for this webinar is I posted this discussion in LinkedIn. Wellness is a business strategy. I asked, tell us about what wellness objections you have heard. And I got well over 40 objections, and they came really, really quickly. I condensed them down to 10 or so, and I've posted those common objections in a PDF, which is if you go to WellSteps, lower right-hand corner, click on Webinars, and then look for Archives. The webinar slides and all of the materials I'm going to mention, including a YouTube video, are all archived there. Webinars, you scroll down to the archives and those objections are there. I want to give a kind of a hat tip to Deborah Laffler, Randy Boss, Dee Eddington, Bill McPeck, and several others in that LinkedIn group who all chimed in on this discussion. It was really a great discussion. What we found, though, basically, after it was all said and done, is that there were basically two kinds of perceived barriers or objections. One was we can't do wellness because of company issues, the way things are set up here in the company. I find that to be a very interesting senior leader objection, but it is. And second, we can't do wellness because of employee issues. So I want to just kind of go in a little more detail about this. One of the first kind of set of objections that we got were all kind of related. Not our business, not our job. What that means is we don't have the education or training to do wellness, and so we're just not going to worry about it. We don't have anyone here with a degree in wellness. We have a lot of people who like to pretend to do wellness, but nobody who really knows about the implementation, about the planning, about the delivery process. So what we're going to do is we're just going to sort of ignore it. And another way to discount that is to say, well, we just don't think it's that important. You hear objections not important a lot when people think that they don't have time or space. Common objections. Another objection that you hear a lot is we're fine doing wellness with the bare minimum. That's maybe it's an annual health fair, or maybe that our broker puts on, or maybe it's newsletters that we distribute on a quarterly basis to our employees. Something that our carrier provides. We're fine with that. When you hear these objections, you have to know something, and this will keep you from beating your head against the wall. What it really means is we're not ready. And just like when we work with people who aren't quite ready, yeah, I know I smoke 5 packs of tobacco a day, and I drink a fifth of vodka every night. I'm just not ready. You don't bother trying to change those people because they're not ready. They won't be ready until some big event happens to promote readiness. Steve often jokingly says the best thing that can happen for worksite wellness is for the CEO to have a near fatal heart attack. And all of a sudden, they're ready to listen about the kind of things that they can do to prevent these sort of things. So organizational readiness was one of the big things that we learned about when we did a pilot study with Kaiser Permanente. We learned that organizational readiness dramatically impacts engagement and outcomes. So if you look at the first set of bars there, we split up groups of companies into those that were not ready. And in this particular study, there was money made available to companies to do wellness by Kaiser Permanente. So financial barrier was completely wiped off the map. Some were not ready, some were sort of ready, but some were highly ready, and they were just waiting for an opportunity to engage in wellness. The money came along and they jumped on it. Well, here's the difference in participation. Over 20% more participation, nearly 25% more participation in the organizations where there was high readiness, and the same with behavior change. So organizational readiness is huge, and I think we do ourselves a big disservice when we work. And if you work for an organization where organizational readiness is just not there, it might be frustrating. Maybe you're a broker who works with a group that needs wellness, but they just don't see it. Now, there are a couple of tools that you can provide that will help with that effort. I'll share some of those with you toward the end of the webinar. So we can't do wellness mostly because we're not ready. What about this? We're worried about employee confidentiality. That's sort of an excuse. What it really means is I'm so doggone confused about all these new rules and regulations. I don't know what's going on, so I'm going to do nothing. If I do nothing, I won't get in trouble. I won't get sued. Nobody's going to come and bother me. Well, you know, that's sort of a barrier, and there's a way to overcome that. What we did is we tried to make this really simple. We provide, this is a free tool. Anybody can use it. It's called the Wellness Compliance Checker. You just go to WellSteps, click on Tools, and we took all of the regulations that are pretty complex around HIPAA, around GINA, some of which flow out of ERISA. We worked for weeks and weeks and weeks. We read these things. We asked people what they really meant in real people English. We boiled down all of those rules and regulations into a little simple questionnaire. And so you can ask questions if you're not compliant in one particular area. There's some simple suggestions that you can do to bring yourself into compliance. Both of those primary regulations, HIPAA and GINA, and you can employee confidentiality, and actually turns out that the bigger issue is discrimination. You can get yourself in line with that and not worry about breaking any of those rules. And we are aware of the changes that are coming down the pike, and we're prepared to update this thing once we get into December of this year. Remember, the key to all of this is helping the leader answer this question. If you had to hire 100 workers by Friday, which would you choose? That's really what we have to remember. We have to help them stay focused on that value, and the blockers as well. So here's another objection that we heard. We tried to do wellness and it didn't work. Now, this is a challenging one. It didn't work means several things. It means that they might have tried an approach, it was not adequately intense, and it didn't create the kind of impact that they expected or that they really wanted. So maybe they did an HRA, or they did biometric screening, they didn't have follow-up maybe, and nothing happened. Or they tried an exercise class, and they cleared out a little space in a warehouse, and about 3 healthy people came for a couple of weeks, and that was it. Or maybe they were impatient. This is a good one. I had somebody once ask me, a person at a company, whether they would see an ROI this quarter. This is a serious question. I apologize if this person is on the call today. I really got this question. I replied, you just started your program last month. You're asking about an ROI this quarter. They responded, well, Mr. Johnson, the CEO, insists on an ROI this quarter, and by gosh, if he wants it, we're going to get that ROI. I said, well, if Mr. Johnson planted corn this morning, do you think he could eat corn on the cob tonight by insisting that it grow? As I recall, that conversation did not go well, which is why Dr. Aldana now works with our sales team. That's a little joke. I did hear that question, though. So that sometimes people get impatient. They expect, we've got ourselves into this problem over 10, 15, 20 years, and we want out by the end of the quarter. Well, that's really not the way it works. So maybe their broker encouraged them to adopt a wellness program that was activity oriented. It's about doing fun things, going to the zoo, doing things, just doing activities. It wasn't really results centered. There really was no objective on what they were trying to accomplish. And there was no question about, if we want to accomplish X, then we have to do Y. Perhaps they didn't understand how important behavior change was to the whole equation, which is where I'm taking all of this. Behavior change, as it turns out, is huge. It's absolutely essential if we're going to get anywhere in wellness. Now, I wanted to let you know that there are often 2 different ways to talk to senior leaders about the rationale. Those who are a little resistant, maybe those who are a little hesitant, perhaps they're impatient. One is to make an emotional case, and the other is to make a rational case. And you need really to understand both. So capturing CEO support, this is a great absolute advantage issue provided by Wellcoa. We've posted that for you. You can also get it from Wellcoa. It's free. But it's useful sometimes for senior leaders to see what other senior leaders have done that was successful, so they get a sense of what really they're in for. There are some fabulous case studies, one about Ted Townsend in particular, that while it's not realistic for some companies, it is interesting to see how committed this senior leader was to making sure wellness, his employees were healthy and well, and their families were healthy and well at the same time. This provides a very, very strong emotional business case, and we encourage you to take a look at this. Now, when you need to describe the rational business case, it's very good to know how to articulate it simply, because often you don't have a lot of time. So here are the basic elements of a rational business case. Most people we talk to say, we're doing wellness because healthcare costs is a source of pain. It makes us hurt. We hate it. We want it to go away. So what they never ask is, well, why are healthcare costs rising in the first place? The reason that their healthcare costs are rising, according to the Centers for Disease Control, is very simple. It's the big lion's share of the reason why is chronic disease. So here's another good question. Why are chronic diseases rising so rapidly? Again, the answer is very simple. Remember, we're making a rational business case. Poor lifestyle causes chronic disease. Who knew? Well, 70 to 91% of these chronic diseases, according to the Nurses Health Study, one of the largest and longest running public health studies that we have in the world, 70 to 91% of these big four chronic diseases are directly attributable to three tiny things: the food you put in your body, whether or not you move, and tobacco use. That's it. These are behaviors. What we also know is that healthy lifestyle reduces chronic disease. This is from a study in Germany. They followed around healthy people and watched what they did and watched what happened. And it was about an 8-year study. And what they found was, holy cow, if you don't smoke, if you exercise, you eat healthy. They added one thing: if you have a healthy weight, you reduce your risk for getting these chronic diseases 36 to 91%. In fact, if you can just do one of the four things I mentioned, you cut your risk in half. So to summarize, if you want to avoid costs and other bad outcomes, reduce chronic disease, reduce risk, and you reduce unhealthy behaviors, and that will get you home. Well, this raises one last question that is sort of related to the rational business case, which is, oh, by the way, 61% of employers agree. In a Tower Watson's report, employers routinely said that their biggest challenge to maintaining affordable benefit coverage was poor employee health habits. So, this is not going to come as news to the senior leaders that you're talking to. Most of them already agree with that statement. So I found that very, very interesting. All right. So how do you change behavior? Well, we like to talk about this as the secret sauce, but really it comes from a really well-known public health model. When you can extend reach, you can reach many, many people with an intervention, and the intervention you provide is enough to create significant impact, then you're going to move the needle and good things are going to happen. Reach times impact is the magic formula. We call it the secret sauce. By the way, the model on the right around impact, awareness, motivation, making employees aware, motivating them to change, providing them tools and skills, and changing the environment or policy in the workplace so that they can change. We're seeing this model pop up over and over as a touchstone for an effective wellness program in various state tax initiatives. And I predict that we'll continue to see it in more and more states. So within that framework, boom, that's what makes the whole thing work. I'm going to share with you some results based on that framework here in just a second. Okay, so what about this? We tried wellness and it didn't work. Well, you're going to hear that one a lot. So, or what about this one? We tried. We spend enough on employee health. This is a tricky one. They can't see the ROI, or I think better yet, Bill McPeck said the value of wellness. They can't see the value of wellness. Our job is to help them see it. So this is the meat of this presentation. I'd like to show you two tools to help you communicate the value of wellness. The first is the ROI calculator. Now, many of you are familiar with the ROI calculator, so I'll spend less time on this. He will help you make a solid business case based on the best and the entire body of scientific evidence that we have at our disposal. The second tool is a new tool, and it's called the Wellness Budget Calculator. It will help you find money to do wellness. It's really, really cool. It's based on some popular trends. Just really quickly, let me first show you this. Those of you who need a little more emotional help making the emotional case, this is a dated study. It's 2009 Healthcare Cost Survey, when Towers Watson was called Towers Perrin. But this is one of the best reports I've seen that in the most clear terms explains what they call a health dividend for high performing companies. I encourage you to get your hands on this. We posted it, wellsteps.com, click on webinars. It's posted there for you. And what it does is it goes over all the elements of a high performing company, what they do. If you're interested in making your organization a high performing organization, it's right there for you.
Hey, Troy.
Yes.
Hey, sorry to interrupt, but we're stuck on the "we can't do wellness because" slide. There we go.
Okay, you know what? Yeah, okay, there we go. This is it right here, the 2009 Healthcare Cost Survey, the health dividend capturing the value of employee health. It makes a great emotional business case for why all this should happen. That said, let's go to the ROI calculator. I'd just like to let you know that the ROI calculator was developed in 2008. Very large organization, health insurance organization on the West Coast, which you would recognize. They came to us, WellSteps, and they said, help us develop an ROI calculator. We want to apply all of the actuarial evidence out there to make a business case with the senior leaders that we meet with about why they should do wellness. And so we developed it. The resulting tool was vetted by several different insurance carriers. There's a very large wellness organization in this country that uses our engine. And we've updated this in 2010, and we updated again in 2012. And the updates for 2014 are actually mostly done. We're just waiting to see if any really good literature appears between now and the end of the year that would change the algorithm. But we keep this thing very, very up to date. We're going to apply the changes that we've kind of already documented. We're going to apply those in November of 2013 for the 2014 version. So that's how we developed the tool. There is a very, very sophisticated, complicated black box on the back end. I want to just explain to you really quickly. So this first one is just a graph of we call this the cost of doing nothing. If you continue to have healthcare cost increases on the current trajectory, this is what's going to happen in the future. We applied some national data, some very, very good national data on obesity and smoking to come up with independent predictions of what wellness would do to both obesity and smoking, how much you would save. And then we took a different database, the entire body of ROI literature, and we applied that. And this basically is what we came up with. So this right here is your ROI. And this is one of the reasons why those people who say they want an ROI by the end of the quarter, they're really not looking at this correctly, because you can see there's a starting point. There is sometime down the road an inflection point where you see divergence begin to happen. And that's why not till 2 or 3 years out that experts say you really don't see a return on your investment, because it takes that long for the trend to bend downward. So rather than ROI, we actually like to say bending the trend. So this is kind of how it works. If you want a layperson explanation of how this works with references, you can go to wellsteps.com, click on tools, click on the science tab, and it kind of goes through the rationale for this whole thing, and it gives you all the references that we use in chronological order. So just FYI, a couple of nuggets about ROI before we move on to the wellness budget calculator. First of all, you need to know that an ROI of 1-to-1 means wellness is free. This wellness it needs to be positioned as an employee benefit. It is something that it has demonstrable impact on that you can't really measure financially, but it has a huge impact on morale. People can feel it. I know of places where they didn't have wellness, they adopted wellness a year later, and vendors that visit once a year came in and just said something feels different around here, and we attribute that to the wellness culture. But if you return what you spent to develop a wellness program, that means you provided a free employee benefit. There's not another benefit we provide that is free. So that's huge to remember. The second thing you need to remember about wellness ROI, it's different from investment ROI. Right? If you invest $100 and you get $200, then we say you doubled your money. Your ROI was 2 to 1 because you doubled your money. Wellness ROI doesn't work that way. Wellness ROI means spending less than you otherwise would have spent. Is this. You spent less than you otherwise would have spent. You bent the trend. That's what wellness ROI is. And the third thing that people often forget is that the return depends on the investment. A small investment will generally result in a smaller return. And in fact, that's what the data show us very, very clearly on a magnitude of 2 to 3 times. There is a fine balance, but you can invest too much in wellness. And I know companies that have invested too much, and it actually has a crippling effect. But they're just a couple of nuggets to remember. Now, let me just show you the wellness budget calculator. This is a really, really cool tool. The goal of this tool is to help you find money to fund an effective wellness program. Now, remember, we showed you the secret sauce a little earlier by making small plan changes or by using a premium differential approach. We know a lot of you out there are using a premium differential approach, but some of you are also doing plan design savings. So let me just explain to you each one of these. Now, this one quantifies how changes in copays and deductibles can produce substantial healthcare cost savings. And actually, the savings that are out there, the money that's on the table, is much, much larger than if you do a premium differential. I'm going to show you that. So all you do is right here, you enter the number of benefited employees, your total healthcare spend, your total annual healthcare spend. You put in your current copay for health insurance and then your current deductible. Then all you do is you come down here and you just play with your new copay and your new deductible. You find out what happens by just increasing it $5 or $10. As you do that, this number right here, the total savings will change. And by the way, this cost of wellness is there so you can see how much you need to save by tweaking those two things in order to pay for wellness. Again, a one-to-one ROI is just fine. That means that wellness is free and you can pay for it based on what you save by tweaking your benefit plan just a little bit. Now, you may wonder what is in the black box that drive these calculations. How did we get these numbers? I know some of you may be skeptical about there, but we're sort of naturally skeptical ourselves. So here's what we did. We worked with a broker who's really, really dialed in, and he helped us get hundreds of rates, all from 9 national carriers. So we had all kinds of data. We put all of that together, and we used it to build a prediction model. So this thing is pretty darn dialed in, and there may be some small regional variations. So the amount of the savings might be plus or minus a percentage point or two, but you'll find that the estimates are very, very, very accurate. The cost of wellness, again, is based on composite findings from 3 national surveys with some adjustment that we made for cost per employee based on company size. Because we know that larger companies pay less on a per employee basis than smaller companies. So we made those adjustments in about 6 or 7 different size bands. So there you go. This is the wellness budget calculator to help you find money by tweaking your plan design. What about premium differentials? A lot of you are doing premium differential. So I seem to be a little bit hung up here. Let me just. Well, anyway, we'll work on that while I kind of talk about the premium differential approach. Now, here, the overview of the premium differential approach is that basically companies will say, all right, we've got to have an increase in healthcare costs. And it's just coming. We're gonna do it. And so what they do is they jack up the rates for everybody, And then they turn around and they say, you know what, if you do certain healthy things, you jump through our wellness hula hoops and we're going to adjust the rates downward for those of you who do that. And so you don't really experience the rate increase if you just do things that'll improve your health. So the way to use a calculator, and I really apologize, I'm severely stuck here. The way to use a calculator is you simply enter the number of employees and the monthly premium discount. And what we find is that the premium discount ranges from about $25 to $85 a month, with the median it's around $45 to $50. We find that most brokers will generally know. Here we go. Most brokers will generally know what that is regionally, but again, 45 to 50 on the median. You'll know best what your number in your region is. And then you enter the percent of expected wellness program participation. Now, this number typically ranges around 30 to 60% initially, but it can eventually reach 100%, which is one of the caveats of this particular approach. So, a word of caution, as wellness program becomes integrated into the culture, there will be fewer and fewer non-participants. And that means that you'll have fewer people paying the higher premium, which you're using to pay for the wellness program. So this will reduce potential savings. It is fair to point out this one last thing before we move on, that with either approach, the employees who are and who are not meeting the requirements, they have to be, the requirements have to be tracked and verified. That's a fair amount of heavy lifting. And you all need to think about who needs to do that heavy lifting. Steve will actually be discussing this in our webinar next month, which I'm going to introduce here in a bit. So that's the Wellness Budget Calculator. It's a very, very cool tool. It's free. It's available to you to help you find money to do wellness. We hope that all of you use it. If you've got more questions about that, you can just email me at troy@wellsteps.com. So back to these objections. We can't do wellness because of employee issues. Well, here's one of the employee issues. We know that incentives discriminate, they punish or compel. Well, if done correctly, this is not the case. And again, I'm going to refer you back to the compliance checker at wellsteps.com/tools. Objection number 2, employees are busy, motivated, or untrustworthy. I find this really funny. You mean they're on Facebook when they're supposed to be working? Oh, I didn't know that. That's a little joke. So they're busy and unmotivated are really part of the same problem. Now, our experience is that no program is ever going to engage 100% of workers. It's just not possible. But greater participation will directly reflect the number of barriers that you can remove. It's important to think about that. So one of the the other barriers is that being untrustworthy. So I just want to show you this really quickly. Here's one of the ways that we helped overcome that barrier. We've got this slick little tool called Rewards. And again, I think Steve's going to talk more about this, but we have a couple of things in this. We have an honor system. There's an honesty policy. And so on a monthly basis, the employee comes in here, they click that they did something, whatever your wellness hoop happens to be, and they have to provide proof of completion. They can upload that, and then that all gets verified on the back end. So we trust, but we verify. Trusting but verifying, when you have a system that helps you do that, it's really a cool thing. Other things on this list, we're not going to bother with that. Like, how are we really going to measure that you parked further away and you walked 3 times a month? We don't know. We're just going to give you 10 points and on we go. This is one of the ways that we provide help to some of our customers around this whole issue, because wellness participation by employees has to be tracked and verified some way. Okay, so we can't do wellness because it doesn't make sense for our employee population. This is one that we hear a lot, and the 2 biggest complaints are that we have a young workforce, and we know that young workers are less likely to incur healthcare costs, or we have a workforce where there's high turnover. And so common objection, and usually when somebody plays this objection, they're expecting to hear checkmate, coming from the other side. And it's really not the case. Here are some programs based on a great article by Larry Chapman, which we posted for you at wellsteps.com. Click on webinars and archives. Here are 5 reasons why you should still do wellness, even if you've got a workforce where there's high turnover or you've got young workers. Young workers are more likely to need prenatal care. Prenatal care that doesn't go well can result in an awful lot of cost to a system. Medical self-care, taking care of simple problems that you can take care of at home, is a less costly way of doing things than going to the emergency room. Tobacco cessation. Cost of tobacco will show up in the system right away in a couple of different, well, 3 different ways. In healthcare costs eventually, but also in absenteeism and in presenteeism, because people who smoke aren't able to do the same amount of work that a non-smoker will do. They're just not physically available. Stress reduction and injury prevention are 2 other ways where there can be quick returns with wellness. So if you've got a young workforce or you've got high turnover, that's not a reason not to do wellness at all. It's maybe a strategy you adopt where you do something a little bit differently, and you focus on some of these quick returns. So here's where you can find these suggestions by Larry Chapman. Okay, what about this? We can't do wellness because this is the one I'm starting to hear a lot. They won't have insurance, so we will have no need to provide wellness. Well, we've kind of, like with the rest of you, we've kind of wondered about how this is really going to go. And what we found is we don't think this is altogether true. There's been a thought that employers would bail on employee health insurance. If this happened, then the thinking is the largest reason for worksite wellness in the U.S. would disappear. But the thing is, we're hearing more and more from more and more sources that all costs considered, it is better to stand pat with insurance. This is a YouTube video from Towers Watson Healthcare, calculating your decision this year. It's about a 30-minute interview. It's very informative. I encourage you to watch it. It's a lot of great information in there. But from the brokers that we meet with around the country, we're hearing from a lot of them that we doesn't look like there's going to be a mass exodus from the burning ship. The total cost of providing care to workers, it looks like companies are still going to be in the health insurance business for a while. So even if employees got dropped off at the National Insurance Exchange, there's still rapid uptake in wellness in countries that have national insurance. So if we were to go totally to national insurance through the insurance exchange, there's still reasons for wellness. This is the case in countries such as Australia, where we work with Ken Buckley, in Brazil, where we work with a couple of different groups, in South Africa, where I've spent some time visiting, in Canada and many other countries, Chile, for example, all have national insurance, and we work closely with all those groups. There's intense and growing interest around wellness. So there remain very, very good reasons to do wellness, even if we were to go to a national healthcare system. And I don't really see that happening for the foreseeable future. So with that said, I'm just going to pause for a minute before we get to some of the evidence. And I promised you one little suggestion that I would offer if I had to do wellness right away. Before we get into the what is the evidence question, let's answer any questions. Ryan, do we have any questions at this point?
Yeah, we do. This one's just kind of funny, I think, whether there's much of a response or not. So you mentioned, you would ask the senior leader if they would prefer 100 healthy workers or 100 unhealthy workers. Jennifer asked, if the 100 healthy workers are hired, then the company may believe they don't need a wellness program since their employees are already healthy. So how would you approach that scenario?
Well, that is a funny question because it's a made-up scenario designed to force the senior leader to think about whether they would rather employ healthy or unhealthy workers. I don't know of any company on the planet that, well, I suppose there may be some, but who have the conundrum of picking from a pool of 100 entirely healthy workers and a pool of entirely unhealthy workers. But let's just say, hypothetically, that were to happen, Jennifer, then I go back to the point that I just made. We have healthy workers. We have no need to do wellness. That's like saying, I just bought a new car. I don't need to change the oil. That doesn't really make any sense. Eventually, you're going to need wellness. And for young, healthy workers, they're still going to have babies. They're still going to fall off. They're still going to tweak their ankles when they're playing softball on the weekends. Or I had a worker who worked for me who did not have health insurance. He was climbing with his brother and fell off a 50-foot cliff and broke some bones in his pelvis, and it was really, really tragic. He didn't think he needed health insurance because he was young and healthy. So there are a lot of things that you can do still with a healthy population that are really, really necessary.
Great. We've got a question here from Alexandra, which I think touches on a few things you've talked about. She says, "Hi, Troy. We've been positioning wellness as a value add instead of as an ROI generator. What are your thoughts around that tactic?"
Well, I think if you're doing that and it is well received in your organization, you're way far ahead of the rest of us, because positioning wellness as a value add, it removes the requirement to provide all kinds of financial calculations proving your existence, which I like on the one hand, because very, very few benefits in the corporate worksite in the corporate community have to provide that same level of financial feedback. You think about, have you ever been in a meeting where a senior leader says to the HR person, "What is the return on investment for vacation time or for sick leave or for the company picnic?" Those aren't, we never hear those kind of questions, because the picnic and the vacation and sick leave, those are all values. Those are all benefits that add value to employment with the company, just like wellness does. So I like that position. I think it's a great position.
Great. I don't know how many you want to take right now, but
Okay, let's save the rest till the end. I just want to go through just a couple of things I promised, and then we'll have about 10 minutes or so for questions, Ryan. So going back to the business case, I'd just like to share this with you, because we get asked this quite often. Well, what evidence do you have that if you can change unhealthy behaviors, that will really reduce risks, and that reducing risk will have an impact on chronic disease, and they will all have an impact on costs? So I just want to let you know, this is sort of our research template, and we take it quite seriously. And we've done research with our customers to find out whether or not this works. This is what we're trying to help all of our customers kind of move this direction. Actually, we're doing this webinar because we're trying to help all of America move this direction. So, impact on behavior. We worked with a water treatment company that had 350 employees. They adopted a wellness turnkey solution based on the secret sauce model I showed you earlier, impact and reach. There was very high participation, which is great. And here's what we saw: an increase in days of exercise per week at 23%, increase in minutes of exercise 53%, fruit servings went up 15%, vegetable servings up 9%, days of smoking down 40%. So we like to say, what is the evidence? We've got evidence that this approach, reach times impact, the secret sauce, it changes unhealthy behaviors. Well, what about risk factors? Impact on risk. This is with another one of our customers. We looked at systolic blood pressure, and this is in the group that had that were red or high risk for systolic, diastolic blood pressure and glucose before anything started. What we found after the program was that there was a reduction in systolic blood pressure. Just in the high risk group, 3.5%, risk in the diastolic blood pressure of 7%, and risk in glucose of almost 10%, risk in reduction in cholesterol. I didn't even put this on here, of 14%. And so what we can, and we had very, very high reach. We had 94% participation in this particular intervention, and so we have great evidence that wellness reduces risk factors. What about chronic disease? This was this study actually was using the WellSteps model before WellSteps was invented. This is one of the pieces of research we used to develop our model. So this was on a group in Utah, and what they had was a population where there were some people who were diabetic, some who were pre-diabetic. They administered the intervention, which was very similar to, actually not quite as intense as the WellSteps intervention, but what they saw was this: migration. A lot of the people who were diabetic now became pre-diabetic. Many of the people who were either became normal. And then they followed this group up after 6 months. And what they found was that not only had they migrated, but they had stayed healthy for 12 months. And there was even a 24-month follow-up. And I think all but two of the people were remained in the the healthier regions. So there's great evidence for the reduction of chronic disease. And the last thing is, what about cost? This again is this is one of our customers, and to give you a fair notice, we provide some services to this customer, but they had started their program before we started working with them. So some of the numbers you're going to see don't reflect us. They do reflect an emphasis on wellness. This is a self-funded government agency. They started their program in 2004. Maybe you look at WellSteps wasn't founded until 2000, into 2006. We started working with them very early, I think toward middle part of 2007. But they did biometric screening and some very, very simple behavior change campaigns. They had pretty high participation, about 60%. They did have a very, very, I think, very robust incentive program. I'm going to show you that here in a minute. Here were their cost trends. Now, these have been equalized. We've shown the slide before, but these were statistically equalized. The line on the bottom represents the participants. The line on the top represents those who did not participate. And here's the projected cost going out. There's your ROI, the deflection point, and the gap between the two became significant over time. Again, the lines that may appear to be different, they were statistically equalized before we did the projection, and here's what we found. There was an ROI of about 3.3, which is very consistent with the literature. The program cost was $1.4 million, and they did spend about almost $1 million of that on incentives. Program saved nearly $5 million, and so the return was what you see there, about $3.4 million. So we have great evidence that wellness done right also has an impact on cost. So if you've got somebody in your organization who's pretty resistant and wants a lot of evidence, the evidence is there. We've got it. We're happy to share it with you, and we've published a lot of this on one of our pages. It's wellsteps.com/wellstepsresearch. You can find it there. Again, you can email me, and I'll put you in touch with that page. I mentioned earlier that that concludes our presentation, but I did mention that if you've got an organization where the leader is just sort of stuck, and you need to but you're employed by that organization, you don't know where to start in the absence of support. Here is my suggestion. On the WellSteps tools page, we have a tool called the Checklist to Change. It's a health culture audit, and it's based on evidence from the CDC, a couple of different CDC sources. You can go there. You can take that as a person interested in wellness, and just answer questions about your work environment. It has to do with vending, the availability of microwaves, refrigerators to bring healthy lunches, that kind of thing. You answer the questions and you get feedback immediately with resources on, okay, so you want to put in a bike rack, or you want to put in a walking trail. Here's how you can do it. And here's some resources that you can use. That's what I would do if I didn't have a lot of senior leader support, but I was employed by our organization and I needed to just do something to get the ball rolling. I would start working on the culture or on the environment. And eventually, when good things start happening, when senior leaders see people out walking around a walking trail that you put in, eventually they're going to swoop in and take credit for it anyway, which is a good outcome. So all that said, this takes us to questions. Ryan, do we have some additional questions?
We do, yeah. One we have here from Heidi. She had asked, you showed the slide where there was 94% participation, and asked how we got it that high, how that participation was that high. And I responded to her that it was participation was tied to a significant health premium discount. She then asked me, asked back to us, how do you get companies to want to tie the program into their insurance? And they've run into companies who don't want to burden employees with a higher cost. Anyway, maybe you could talk about that, and specifically about doing that on the participation-based level, and maybe on an outcomes-based level.
All right. Well, that's a lot of information in that particular question. Um, if you go back to the wellness budget calculator, and I just remind you, you have really two choice. If you don't have money for wellness, you have two approaches. One is to tweak the benefit plan by slightly raising copays or deductibles, and the other is to do premium differential, yeah, where you raise the insurance rates, and then you, if you for those employees who jump through the wellness hoop, you're going to let them stay on the old rate. You can there's a lot more money available on the table by tweaking benefit plan than there is by doing a premium differential, because a premium differential is a little difficult to sell. It involves raising the rates for everybody. That's generally not a popular thing. So if I were to try to do it, I think I would try to sneak in through the, you know what? Let's not worry about that. Let's just tweak this copay by $5 or $10, or let's raise the deductible by $100 or $200. For most people, that doesn't really come into play. I think that's what I would do. Um, and I do think there may have been more parts to that question, Ryan. Maybe you could follow up with me there. Is there any additional part of that question
I would
you
just add
addressed?
to that, if the company does choose to do a program based on premium differentials, making it a participation-based program rather than maybe, there is the option to do outcomes-based as well, but maybe starting out as a participation-based program won't, it makes it easier for those employees to accomplish that, and isn't quite as much of a burden unless they willfully choose not to participate. So
Yeah,
anyway,
and
if that's how you're trying to
yeah. So
explain
to
that to me,
to
yeah.
clarify the difference there, that's an IRS regulation, Department of Labor regulation, and basically you can have a participatory wellness program, which means you get the premium differential or you get the benefit if you just do something. Whereas an outcomes base, it requires you to meet some sort of health standard. The difference would be in a participatory wellness program, you would just ask the employee to prove that they got their blood pressure measured. But in a outcomes based program, you would require them to meet a blood pressure standard, or alternately to be doing something about it, to be under a doctor's care or to be engaged in some sort of behavior change program to help them reduce their blood pressure. So that's sort of the difference. And we, especially in the beginning, I think we would lean toward recommending a participatory wellness program. It's much softer. It tends to feel a lot more like you're being motivated with a carrot than a stick. It's a great question.
She did have a quick follow-up, which is basically, so if they want to change their plan design, would they need to do that through their insurance broker? Maybe you can answer that. I mean, I would assume that would depend on, on their individual company, how they would go about changing the plan design, but if you have anything to add about that.
Yeah, you should just be able to work right through your health insurance broker. And again, the wellness, but you can inform your wellness broker to say, look, we need this much money to pay for wellness, and we can get that by tweaking our whatever you choose to use by this much. Please help us do that. Your health insurance broker will be able to help you do that. If they can't, then you need a new broker.
One question that Cheryl had, which is kind of a follow-up to the value add question. Um, are there any metrics that are available that show that, I guess, substantiate that wellness is an actual value add, and maybe the metrics that show what value is added by outside of ROI and things like that by providing a wellness program?
Well, I can tell you this. One of the values, let me just list them for you. The values are better morale, really, really hard to measure. Um, present productivity. That's in some environments, like a manufacturing environment, that is measurable. But measuring presenteeism has been a challenge that has vexed some of the smartest people in this area for a long time. How do you measure it, and in a way that um, bean counters will buy into the validity of your measurement? That's another challenge entirely. The best I can say about that is that the World Health Organization got a guy from Harvard to develop a measure of. I might be getting that right. It might be Stanford. It's at a university where people are really, really smart. Let's put it that way. And he developed a measure of the productivity for the World Health Organization, and for me, that stands kind of on its own feet. So the measurement part is hard because the values tend to be I think we scientists would call them a little softer. Where the only one that is not entirely soft is absenteeism, but the truth is absenteeism only accounts for about 6% of the total cost of poor employee health. So it really is a small fish in a big pond. It's really not that consequential. Anyway, the values are difficult to measure, but they feel really good.
Okay, one that maybe we could end on this question. This is from Kapil. I think I'm hopefully saying that right. Asking, how do you get by the blockers? And I guess, that would be those, you can interpret that how you want, those who are blocking the implementation of a wellness program.
You know what? If I had the answer to that question, sometimes you don't need to get around the blockers, because if you get around the blockers are going to be chasing you down from behind, and they're going to try to tackle you or sabotage what you're doing. A better approach than getting around the blockers is to try to get the blockers on board. To help the blockers understand by helping you make this business case that their life is going to be better. So what you're essentially doing is making the business case, both the emotional and the rational business case, to the blocker until the blocker sees that it makes a lot of sense. And in some cases, we have done this where we have helped the broker or sometimes a middle manager make an effective presentation around wellness. That actually winds up being a lot more influential than sometimes if we or maybe you had made that same business case. So you just have to work with those people using the same principles that I just talked about. Overcoming objections. They can be had by anybody, and most often, like I said in the beginning, senior leaders tend to get it. It's the blockers that don't, and you're really overcoming objection with the blockers. But don't try to go around them, because they'll mess you up from behind. So I think that's really all the time we have today. I would like to thank all of you so much for your attendance and your participation. We'd like to invite you to join us for our next webinar, How to Make Participation Incentives and Outcome Tracking Hassle-Free. This webinar will be presented by Dr. Stephen G. Aldana. It'll be on June 27th at the time appropriate to your time zone, 11 Eastern and 8 Pacific. We hope you join us. Thank you, everybody. Have a fantastic weekend.